Here's the recording to finish out the lecture from Thursday with the end of the chapter 8, material antiemetic drugs. So antiemetic drugs are used to control nausea and vomiting. And first, before we talk about the drugs, let's talk about what causes nausea and vomiting. So a couple of different things that cause it include irritation of the intestinal mucosa or the stomach. This could be caused by bacterial or viral illnesses or something that directly irritates that mucosa. Another cause of nausea and vomiting is by stimulating the chemotrigger zone, or what we call the CTZ center in the brain, which is known as the vomiting center in the brain. Some of the causes of stimulation of that chemotrigger zone include chemotherapy or other drug medications, radiation. So certain types of drugs other than chemotherapy, narcotics sometimes can cause someone to be nauseous. Surgery can be another, especially abdominal surgery, increased pressure from the gas and air that's usually pumped into the stomach when they're doing surgery. Also, surgery can stop peristalsis. It has a anticholinergic type impact, fluid accumulation in the GI tract that can cause distension and bloating and trigger post-op nausea and vomiting. Patients who are actively vomiting cannot take oral drugs. So many of the antiemetic drugs are available by alternative dosing forms and routes of administration, including suppositories as well as injection. Some also come in melts or ODT, which stands for orally dissolving tablets. Now, the drugs that we use to treat nausea and vomiting, some of them act by blocking dopamine receptors, and that prohibits the activation of the receptors in the wall of the GI tract. It also helps to block the trigger in the chemotrigger zone in the vomiting center of the brain. The drugs listed in your book, the one that I've highlighted on your drug worksheet is promethazine, which is Phenergan. That's in the class of a phenothiazine. It has anticholinergic activity, some antihistamine activity, so it's pretty effective at treating nausea and vomiting. It comes orally, it comes as suppositories, and it can be given by injection. The other drugs that I have highlighted on this slide, dolasetron, ondansetron, and palonosetron, you see they all end in cetron. Those drugs actually will block the chemotrigger zone. They are what's called 5-HT antagonist drugs. 5-HT is actually serotonin. So these block serotonin receptors in the chemotrigger zone. But like I said, the Phenergan is what our highlight is. The side effects for Phenergan are anticholinergic, so dry mouth, urinary retention, constipation, blurred vision, maybe some drowsiness. So antiemetic drugs are used also to treat motion sickness, which occurs when there's motion, disruption of the inner ear. Sometimes it's also got a visual cue that activates the vomiting center in the brain, and then also vertigo. Vertigo is a sensation of dizziness or whirling, especially if you stand like on the edge of something and it's associated with heights. That's what most people associate it with. But if you have fluid in your inner ear, you can have that feeling just by standing up. It's usually caused by irritation or infection or a fluid buildup. It upsets the balance and stimulates the vomiting center in the brain. Antiemetic drugs that are used specifically for motion sickness or vertigo are to help correct that feeling of fullness or that disruption. So we often will use anticholinergic drugs, block the inner ear stimuli from reaching the chemotrigger zone, and reduce the sensitivity. So the drugs that are listed here are all anticholinergic, and two of them actually well, diphenhydramine is actually an antihistamine. Dramamine. Meclizine is antivert. It's also sold over the counter as Dramamine 2 and Bonine, so you may have heard of those. But these are drugs that are used to treat vertigo or motion sickness. Also, an anticholinergic agent called scopolamine comes in a transdermal patch. It's a small little dot that's placed behind the ear, and that's called transderm scop. So if you've ever been on a cruise, a lot of times that's what they'll give people to prevent the motion sickness. So here's some packaging for Dramamine. This picture is also located in your book. So antagonist or antiemetic means to be against vomiting. A lot of those are chewable. The last part talks about drugs used to treat obesity. The drugs that are used to treat obesity work in one of two ways. They either prohibit fat from being absorbed from the intestines to keep the fat content down, or they will suppress the appetite so that the patient will eat less. To prevent absorption of the fats, there's a class of drug called lipase inhibitor drugs. So lipase is an enzyme that's necessary for that fat to get broken down so it can be absorbed. So this will chemically bond to that lipase, and then you can't break down the fat, so then therefore you can't absorb it, so the fat gets excreted out. Orlistat is the generic name. Its prescription strength drug is called Xenocol, and it's also available as an over-the-counter drug called Ally. And they named it this way as being your ally or your helper or your friend in losing weight. So it's one of those conscious efforts to attract an idea to the public. We also use appetite suppressants to treat obesity. These drugs are known as anorexins. Similar in chemistry to amphetamines, but generally less addictive properties. We actually still do also use amphetamines to treat obesity. Common street name for amphetamines is speed. So it helps to increase metabolism, but it also suppresses an appetite. So it works by affecting the dopamine or serotonin levels and the satiated center of the brain, so the part that makes you feel full. These drugs should be limited to short-term treatment and with dietary restrictions. These drugs, many of them are controlled substances, so they still have a potential for abuse or dependency. So we have to be careful when a patient's taking these drugs that they don't stop them abruptly. They need to be cautious and taper down because they could develop a drug dependency, and if they're stopped abruptly, it could result in withdrawal symptoms. So the drugs that we use to treat obesity, the control substances, are either a Schedule 3 or a Schedule 4, and the one that I've highlighted on your drug worksheet is a fairly newer drug. It's lorcaserin, which is Belviq. Also, the antidepressant drug Wellbutrin, which is bupropion, generic name, can be used. And an interesting thing about this drug is also sold by the commercial brand name of Zyban and is used to help with smoking cessation. So what it does is that it helps control that pleasure center in the brain and make it feel like everything's good, so you don't need another substance to trigger that. We use combination drugs for weight loss. It's a Schedule 4 drug and an anti-seizure drug together, Qsymia, which is phentermine, and topiramate. So topiramate is also a drug, even though it's an anticonvulsant or anti-seizure drug, has been found to treat many different things. We use topiramate to treat migraine headaches, but it's also used to help with maintenance of addictive alcohol abuse and, in this case, overeating. Narcotic antagonist with an antidepressant drug, Contrave, is naltrexone. Naltrexone is related to naloxone. So it's an opiate antagonist, so it blocks that receptor. And bupropion, which I've already discussed the properties of it, helping identify that satiation component in your brain, that antidepressant. So that finishes out chapter 8. So we will have a quiz on Monday. Please make sure that you've read through the chapter and that you complete your worksheet and the assignment that is online.